What is it like to first perform procedures on patients?
It's terrifying. It is terrifying. And the first time doing anything on patients, it never stops being scary. Again, same as kind of talking to patients, etc. It gets easier the more you do it, but it's always a bit scary. And you just sort of get, you develop those skills in sort of managing your own stress and just going, and then getting on with it. And after you do it the first time or a couple of times, you get it right, then that skill becomes something you're not as anxious about.
It was quite scary to first perform a procedure on a patient, and honestly it was quite disheartening as well. So my first procedure was taking bloods from a patient back in third year, and I wasn't successful at it. So because, well, prior to that, the only time I'd done it was on a dummy arm. It was something that I had to, kind of nurse my wound for a bit, and then over time kind of just pluck up the courage to keep going and keep trying and keep doing. And I would say that in fourth year I'm a far sight better than I was back in third year. So, well, I mean, that's a good sign. And the same thing applies with other procedures like urinary catheters and like setting a line in the patient for drips, things like that. It will always be scary the first couple of times, but there's always someone to guide you and give you tips and make you better. And it's about seeking opportunities to get better. Everyone's always really patient with you, so that's handy.
Performing procedures on patients can definitely be tricky. Everybody's body is different. Nobody has the textbook perfect body, from drawing blood to listening to heart and lung sounds, giving injections. There's a lot of practical elements to medicine, and I'm really excited to start learning to carry these out. But I also am so grateful that there's a wealth of simulated robotic dummies and prosthetics that you practice on first. We haven't had a chance to use them this year yet. Our clinical skills teaching hasn't started yet, and with the pandemic, everything's on pause. But last year I did go to one of the medical schools conferences and get to use some of them there to give spinal taps, and it really makes you feel like a legit medical student when you get to start doing this practical training. So I think that is definitely the part I'm most looking forward to actually happening.
So performing your first procedure can be quite daunting. You just feel like you're using the patient as a kind of dummy, and you can feel quite guilty about it. But everyone has to learn. You have to start somewhere, and if the patient's always been informed about that it's maybe your first time or that you're a student, so they've agreed to it, and they usually are really, really nice and really supportive, really patient. But if you're not confident or comfortable doing it that day, just feel free to say. Just make sure you've got people around you that you feel comfortable with, that you feel comfortable asking questions, and that you watch as many of the procedures as possible so that you kind of know what you're doing for next time.
So I haven't myself performed any sort of procedures such as taking bloods, but I have listened to people's hearts and lungs, and at first it's a bit like speaking to patients for the first time, quite intimidating, but generally, again, doctors will pick patients who are quite good at teaching you and will be very patient with you, and it was quite fun actually.
So the first thing to remember is that you'll always have someone there with you to take over if things don't go to plan or to point you in the right direction. You should have practiced enough on dummies beforehand or on each other, so you'll have a good idea of the procedure itself. However, it doesn't always go to plan. Like the first time I went to take blood, the minute I put the needle in the woman's arm, blood gushed everywhere. She ended up with a massive lump and a bruise. It was very embarrassing, but you've got to remember that it's all part of the learning experience and no one is perfect first time.
I'm really looking forward to as well, getting to examine patients and getting to take blood, and it's something that I really want to work on and hopefully get really good at.
First, it was a bit scary because you're not practicing on a model, you are practicing on a real human being who can feel pain. But however, once you gain more experience of practicing these types of procedures, it does become a lot easier and becomes just part of the daily routine.